Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Nabil bin Zulkifley. I am currently studying in UITM in dentistry, and for today's video I'll be teaching or explaining the importance of oral hygiene instruction. First of all, what is periodontology? Periodontology or periodontics is a specialty of dentistry that studies the supporting structures of the teeth as well as the disease and the disease that affect them. Basically, from the teeth model here, we can see there are red pipe that cover the downward side of the teeth. This is gum, and basically, from the teeth itself, there are two parts that can be studied, which is the crown and also the root in the gum. From the picture that have been provided here, we can see on the anatomy of the tooth there are two parts of the tooth, which is the crown and also the root. From the crown, we can see there are three different parts, which is enamel, dentin, and also pulp. And for the root part, there are four different parts, which is the gum, the cementum, the root canal, and root canal opening. The cementum holds the root firmly to the gum to prevent the teeth from moving. Next, I'll be explaining on two different disease or condition that usually occur in our mouth, which is gingivitis and also periodontitis. Gingivitis stands for inflammation of the gingiva or also inflammation of the gum. And usually there are a few symptoms that we can observe to identify either it is gingivitis or periodontitis. For gingivitis, we can see there are redness and sponginess of the gingival tissue. Redness. There will be bleeding or on provocations, means maybe during our brushing or maybe during our flossing there will be some bleeding. Next, there will be change in contour, means the gums itself will be in the tooth, there is some recession. Next, there are presence of calculus and plaque here. And lastly, the bleeding score of the mouth will be higher than 10%. For periodontitis, periodontitis is the next stage or advanced stage of the gingivitis, where it will be more worse and it also will affect a lot more things. So for periodontitis, we can see usually it will be recurrent gum swelling. There are pocket formation. Next, there is a gum recession. Here we can see there are presence of the root. Next, there are bleeding upon brushing. Next, halitosis or also bad breath. And lastly, tooth mobility. It is very important to control the plaque in our mouth, because firstly it will be preventing tooth decay, also as we know cavities. Next, we can reduce the risk of any gum disease. We can also prevent any tartar formation if there is less plaque. From controlling all of the plaque, we can also prevent halitosis or also bad breath. Next, we can also support the overall health of the mouth. And last but not least, we can maintain all of the aesthetic appearance in our mouth. Patient is a 43-year-old female. She had diabetes mellitus type 2, controlled with metformin 500 mg OD, and latest HbA1c is 6.8%. Patient has never done any periodontal treatment, and recently she has her 3-8 and 4-7 extracted. There are no complications. She runs her own business and her stress level will be 6/10. She is a non-smoker, and she is not aware of any paraprofessional habits. From all of the tests and all of the exam that had been done to the patient, there are a few problems and also there are a few observations that are very obvious that can be seen. And first and foremost, from the periodontal pocket charting here, we can see there are a lot of teeth that has a problem with when we probe on the teeth, there will be a lot of bleedings. And also most of the teeth has a high number on the pocket depth, which means that the root of the teeth does not have a lot of supports because the gingiva does not hold the root firmly, and it will cause a pocket depth. And as like I've shown here, there are pocket depth, and this is a very one of the risks to have a plaque accumulations. And from the OPG that has been provided here, we can see a generalized bone loss in between the teeth. What bone loss does is it will make the periodontitis, it will make the gingivitis much worse because the teeth does not have any support from the gingiva. And as for an example, I have provided the picture of stages of periodontal disease here. At first stages, we can see the teeth is healthy and the gums is healthy. All the alveolar bone are still intact and there is no inflammation on the gum. The second stage will be gingivitis, and there has been some reddening of the gingiva, and it will cause some irritation to the gingiva. The third stages will be early periodontitis, and it is advancements of the second stages. Number 4 will be moderate periodontitis, which is we can see there are a lot of recession that shows the root of the teeth. The gum are also inflamed, and most importantly, the alveolar bone has resolved. And last but not least, the fifth stage is advanced periodontitis, where we can see a lot of bone has been resolved. The gingiva has red, lot of red, and it also can cause gingival recessions and cause sensitivity to the tooth. Now, I will be showing to all of you all of the oral hygiene aids that are available in the supermarket and also at the nearest pharmacies. This is a new toothbrush. We can see here the bristle is very soft. This is a children toothbrush, which is usually come in a smaller size. This bristle is also very soft and it is sometimes very bright in colors to attract kids to brush their teeth. This is a tongue scraper. It is used to scrape our tongue to prevent any bacterial accumulation on the tongue. This is a toothpick. It is used to remove any stuck food or particles in between our teeth. This is a floss holder. It is used to hold our floss in like this, and it will make our life more easier to floss our teeth. This is a single tufted brush. It is usually used to reach the tooth that are very far back, and also it is for more precise cleaning in between the marginal gingiva and the tooth, so it can get more of the plaque itself. This is an interdental brush. It usually comes in various sizes, and it is meant to clean in between our teeth by inserting this brush in between teeth. This is dental floss. We will be using this by flossing in between our teeth to prevent any food stuck, or also to prevent any plaque accumulation in between our teeth. This is a toothpaste. It's basically cleans the teeth and also prevent any plaque and also prevent any cavities from the teeth. This is a mouthwash. It's basically used to freshen up our breath and also to remove any food particles and also remove any plaque. This is a super floss. This is basically floss, a normal floss, but it usually uses for braces, bridges, and white space. It usually comes with 3 parts, which is stiffened end, spongy floss, and regular floss. This is a floss threader. It usually uses for braces or any area that are really hard to reach. What really differentiates between floss threader and normal floss is this floss is designed with a loop end. There are a few methods that patients can learn and also apply to improve their periodontal health and also their overall mouth health. There are a lot of methods that can be taught, and also a few of simple things that the patient has done throughout her whole life can be improved more in order to maintain and also to improve her periodontal health and also to improve her overall mouth health. Things such as toothbrushing, interdental cleaning can be improved more and also can be taught on what is the most effective way to reduce all of the plaque and also reduce all of the bacteria in the food in the mouth. For toothbrushing, we can use the technique modified base technique, which is a way of brushing the tooth while using a 45-degree angle at the gum line. Next, for interdental cleaning, this is a very important process since there are a lot of bone loss in the patient, where we can teach the patient on what to use, what is the most efficient product or also stuff that we can use to prevent any plaque accumulation in between teeth. Next, we can also use the mouthwash, which is used to freshen up the mouth and also to rinse the mouth from all of the bacteria and minimum. We can also teach the patient on tongue scraping or also tongue cleaning. This is usually most forgotten procedure or stuff that the patient or normal human will always forget to do, but it is very important to clean our tongue, since this is a site where a lot of microbacteria accumulate here. Next, we can also advise to the patient her diet and also lifestyle advice. Next, we can also encourage the patient to have a professional support. So means we can set her appointments 3 to 6 months to check and also to monitor her periodontal health. And last but not least, I'll be showing the demonstration and also on how to toothbrush correctly and also how to floss correctly to the patient. Right now, I am going to show to all of you one of the ways on how to improve our brushing technique. This is the lower teeth model, as we can see here. First of all, I'll be explaining on the modified bus technique. What it is very simple technique where it is required to brush our teeth to angulate our toothbrush 45 degree to the angle of the tooth, and by simply following this motion we can improve our toothbrushing technique. And then it is very important for all of us to really master this very simple technique, because it is really easy for all of us to follow. And by doing this motion where we angulate the toothbrush at 45 degree of the teeth, we can see here that there will be a ridge of the soft bristle in between the tooth and also the gingiva. Means the soft bristle can reach in between the marginal gingiva, the marginal gum, where mostly leftover foods and also leftover plaque. The next method on how to improve our toothbrushing technique will be the Stillman technique. The Stillman technique are divided into two, which is the Stillman technique and also the modified Stillman technique. First of all, I'll be showing on how to demonstrate the Stillman technique. First, we'll be placing our toothbrush in the area of our teeth, and next, in the upward motion, we'll be brushing our teeth in the upward motion. From this motion, we can ensure that all of the leftover food and also all of the leftover plaque that is stuck in between the teeth can be reached by the bristle of the food, and simultaneously the brush will push all of the leftover food and also all the leftover plaque upward, and we can remove it easily. Next, for the modified Stillman technique, all we need to do is just a simple circular motion, where from this method we can reach all of the site or area that cannot be reached by using the Stillman technique. From the modified Stillman technique, we can see here the area that are being covered are more bigger, and this will ensure all of the leftover food and also all of the plaque can be get ridden up, and this will ensure a good oral hygiene practice in our mouth. Next, I'll be teaching on how to use a normal dental floss that are available at Guardian, Watsons, or any normal pharmacies that are out there. So basically, flossing is a common thing that need to be done after brushing our teeth, and also it need to be done daily. And usually people don't really appreciate flossing because it is a really a long process and it needs to be done on each tooth. But basically, flossing is just like a string where we can cut it, and we need to stretch it, really stretch it, and in between tooth we'll be flossing the tooth in between tooth. Next, I will also be showing on how to use a single tufted brush. This is a single tufted brush. It looks like a normal toothbrush, but on the bristle side there are only one side here. Usually we'll be using a single tufted brush to brush the area where it is very hard to reach, such as the third molar on each quadrant. Usually we'll be using it to reach in between the marginal gingiva and also the tooth in this motion, lingually and also the buccally. So from here, it is more reachable, and also we can use single toothbrush to brush at the occlusal of the teeth. Next, I'll be showing you on how to use interdental brush. This is the shape of it. It comes in a few different sizes, and each different sizes can be used in various reasons to reach different place. So Usually we'll use interdental brushes. The function is still the same as the normal flosses here, but it is more easier to use the interdental brush. Where how does we do it is basically on the interproximal side, on the east side in between the teeth. We'll be using it to reach the area where it is not reachable by normal toothbrush. This will ensure on how to remove plaque efficiently, and also to remove all of the leftover foods efficiently. And last but not least, I'll be showing you on how to use super floss. It is ideal for braces, ridges, and white space. And the super floss are divided into three parts, which is the stiffened end, the spongy floss, and also the regular floss. So basically, why it is divided into three parts? It is basically make it more accessible to reach in between the white space, such as this bridge here. We can insert the normal floss side first, and once it reach to the spongy area, we'll be using it as our instrument to clean all of the stuff in between the white spaces, such as, for example, this bridge here. We can remove any excess food here, we can remove any plaque, or also anything that can interrupt our periodontal health. There are a few different type of periodontal treatment which we as a dentist will be using to assess and also to examine the overall periodontal health to the patient. This periodontal treatment are very important because it can maintain our periodontal health and also our overall health. There are a few different type of periodontal treatment, but first of all, I'll be explaining on what is plaque scoring. Plaque scoring is a type of test that we will be doing by using a plaque disclosing tablet, and from that we can assess a few different areas in our mouth to show that where the plaque will be growing, where the plaque will be accumulating a lot in our mouth. Basically, we'll be asking our patient to rinse her mouth or his mouth first, and after that we'll be giving plaque disclosing tablet, and we'll be asking the patient to chew on the plaque disclosing tablet and also spread it up throughout her mouth or his mouth. From there, we'll be asking the patient to open their mouth, and we'll be assessing a few different areas where if there's any plaque accumulation, we'll be chart it in our items. This is a very important step to maintain the overall health of the patient mouth. And from the plaque test, we can educate the patient on what are the importance on maintaining the overall health of our mouth, and we also can educate the patient on why the plaques are very dangerous. Usually, the plaque test will be done in a few different visits, where we'll be assessing the plaque score in a few different appointments. This is very important because the dentist can keep on track on how does the patient maintain their oral health. And also, since we have done our plaque test, we can also show the patient on how to modify or how to improve their brushing technique by using the buzz technique that I have taught before, and also we can use the Stillman technique where I have shown before, to improve their overall health of the mouth. Other option for periodontal treatment is scaling. Basically what is scaling is, it is procedure that are usually done to remove hardened plaque or also calculus, and usually it is located at the place near our salivary gland. Usually it will be located, the calculus will be located at the back of our lower incisal teeth, because there are salivary gland located at the bottom of our tongue. And the procedure will be, we will be using two different types of instrument, which is curette and also ultrasonic scaler. The dentist will be removing all the hardened plaque by using these two different type of instrument, and it will be cleaning thoroughly in the supragingival and the subgingival sides, means on the teeth and also in the gum area, inside the gum area. Next, other periodontal treatment that are available at dental clinic is root debridement. Basically, root debridement is a more advanced process on cleaning the teeth, and usually it targets the root of the teeth. Usually, the procedure will be done when there are a deep pocket that can be formed by the inflammation of the gums. From the root debridement, we can remove all of the plaque, all of the calculus, and all of the bacterial toxin that are embedded in the root surface. From root debridement, we can also smoothen the root surface and promote gum reattachment. We can also promote to prevent bacterial adhesion at the root surface. By doing root debridement and scaling, we can remove the source of the inflammation of the gum. We can also promote reattachment of the gum, and also we can promote healings of the gum tissue. Next, other periodontal treatment that are available in the clinic are periodontal pocket management. Basically, this procedure will be done when during basic periodontal examination, there are scores that are 2 or higher, and for periodontal pocket management, we'll be assessing the depth of the periodontal pocket using periodontal probe to measure or to know the severity of the disease. From periodontal pocket management, we can assess the overall health of the patient gums, and also from the periodontal pocket management procedure, we can do root debridement to remove any plaque or also calculus in the root area, to promote the healing of the gums, and also to promote reducing of the inflammation of the gums. Next, the last step will be the most important step, which is the follow-up and maintenance. All of the patient that has a very severe or also very mild periodontitis needs to have an appointment and also a follow-up that needs to be done to the specialist. Usually around 3 to 6 months each year, there will be a few follow-up procedure, and all of the gums health will be rechecked, and we can reassess the plaque score and also the pocket depth. And the doctor and the specialist can do a lot of procedure to maintain the cleanliness and also to maintain the healthiness of the patient gums and also the teeth. From all of the treatment that I have mentioned before, there are a lot of benefits that can the patient achieve by promoting the gum health. Firstly, we can promote reducing bleeding, reducing swelling, and also to reduce the bad breath of the patient. We can also reduce the pocket depth, and also last but not least, we can improve the patient oral hygiene information. From here, we can see that it is very important to teach the patient on how to maintain a good oral health, because preventing is better than curing. If the patient have a very strong knowledge about maintaining their oral health, The patient doesn't need to come to the clinic more often, and from there, the patient will be saving a lot of money, and also the patient can maintain their oral health by from the home. That's all from me. I hope uh, all of us can benefit from my video, and all of us can learn the importance of uh, maintaining the health of our teeth and also the health of our gum. Thank you.